Two women. One spent 24 years as a nurse in intensive care and operating theatres. The other, an accredited mental health social worker supporting people through trauma. Like us, many of you have lived inside the systems and have your own lived and living experiences. We're not telling you our names just yet, but we will tell you why we're here. There's a wound for frontliners that workplaces won't name, and it's not just burnout, it's moral injury. What happens when the system forces you to choose between your conscience and your calling? We've lived it. Our differences are what creates unity, and the conversations that heal happen between peers. That is what Between Peers is all about.
Today's next story is under the Reddit subcategory of Reddit Nursing AU. It's one day ago, so it's a 2026 story of essentially July 2026. Okay, here it is. The new nurse questioning their career. Advice seeking. Hey all, I've had my third week at a new hospital. I'm an enrolled nurse. I'm in my early 30s and I've worked really hard to get here. Obviously time off for having children in between their study. I've had a passion for nursing since my first receptionist job over 10 years ago. I've made so many mistakes since starting. For an example, missing a medication or missing information on handover, such as a fluid balance chart, missing to document a neurovascular obs. I'm starting to question whether I'm cut out for this career. I work with a really supportive team and I can't help to think I am a burden for asking so many questions and being so slow. My question is whether this does get any easier. I'm anxious before my shifts, so I overthink everything on my days off. Is it worth sticking it out? Thanks to you all in advance. So what's your opinion when you hear this story so far?
I think, oh, poor baby. It's really hard when people first start out, especially when they're new grads, regardless of what frontline work they're in, especially because lives depend on the work that we're doing. And so I think it's really normal for new grads to make mistakes or need extra support. And as a senior member of staff, I know that, and I make sure that I'm available or factor that into my day so that I'm able to be there, or I factor it into someone else's day to be there to support them. I think that's probably what I initially think of. And everyone's anxious in the beginning and they can really overthink things. I did notice in one of the feedback responses that, which is something that's quite different to my role as a social worker, that as a nurse, you're just there, your patient, just for your shift. And then you do the handover and then there's someone else's patient, and you may or not get them as a patient when you come back, but it's like having a completely new patient with a new set of problems when you come back. So I guess that's a little bit different in that you don't necessarily have to take that stuff home with you. Like, it's not good for your nervous system to be worrying and stressed about it afterwards. Yes, critical self-reflection is really important, and how can I do things differently next time, but not obsessing about one particular client or one particular mistake.
So my viewpoint is they started the shift alive.
Yeah.
You left and they're still alive.
Yeah, right.
Okay. First and foremost.
Yeah.
Second of all, missing a medication, I don't know. I'll have to find out more about the medication. So I'll just put that in the don't know pile. Fluid balance chart. Well, as you've just, fluid balance chart is the in and out. So it's very, fluid balance chart
Water in, wee out.
Yeah, wee in, wee out, but it's also oral.
That's what I mean,
liquid,
like drinking.
Drinking, everything. Yeah. Now, it's significant for people who are in renal failure. It's significant for people who are, we're worried about their cardiac function and we're watching. It is just a routine post-op for the first 24 hours, just making sure that they're hydrated. It's not going to kill them compared to the examples I've just given. Mm-hmm. Okay? Now, if you've only been out for 3 weeks, you are not going to be given, in theory, I could be lying, but in theory, really hard, difficult patients where their fluid balance chart is that strict because they're on 500 mil limit for 24 hours.
Yeah, you'd hope that a new grad
would
be given the least risky
patients, okay?
Yeah.
The patients who are about to be discharged in the next 24 hours sort of concept, okay?
Yeah.
So because really of my knowledge and my insight and assumptions, I'm looking at this and I'm going to be as blatantly disregarding politics and bullshit aside, go, They started the shift alive. They ended the shift alive. They're only 3 weeks out. Surely that they've been given the easier workload. So if they've potentially missed vascular obs and or the fluid balance chart, they're not going to kill a patient in theory, because the patients they should have been given are the stable ones. Okay? My perspective, I could be wrong though, please. I mean, I could be wrong, but from my perspective, if I was the team leader, they would be getting the easy patients while they're building confidence.
Yeah.
Okay, my opinion. Okay. So the only thing I would want to go over with them just to check is what medication was missed. Okay, because that may or may not have impact. Okay, but in theory, is this a 12-hour shift or an 8-hour shift? Because we don't know.
Yeah.
There is other nurses to check. First of all. Second of all, technically, as she is only an EN, is she an endorsed enrolled EN, which means you can give out medications, because I will assume that's the case with the way it's written. Don't we, in theory, based on our previous starters that we've just read 2 episodes ago, have to have another nurse, registered nurse check the medication because they're a new grad?
Yeah, exactly.
So I would have to say there's more than one person in play on this.
Yeah.
Based on some of the other Reddit posts that we've discussed, okay? So I'm not saying I'm right, I'm not saying I'm wrong, I'm just putting other things into context. Now, at the end of the day, my opinion, we need to be, yes, things are missed, but they're going to be missed regardless, because there is so much you're trying to absorb very, very quickly. We all make mistakes. As I said, I don't believe they're life and death mistakes. I believe they're learning opportunities. But technically, her colleague she's supposed to be, in my opinion, checking her drugs with, missed it as well. Regarding vascular obs and fluid balance charts, normally when you work, I don't know anymore, I could be lying. Back in the olden days, an RN and an EN would work together. So you'd do one set of obs, I'd be doing the next set of obs on the patient beside. Or if I was, as the RN was doing the drugs and you were the EN, you'd tell me that you've done the obs. I could easily, because I always did, is Joe Blogs, Vasc obs, okay? Is there anything I need to know? So it's a team, not an individual.
Yeah.
But that's how I work. But it could be different nowadays. Like, I don't know.
Well, I thought with, like you were saying, with medications, and I guess it depends on who it is, but there's always 2. I guess it depends on the medication.
Not on every medication.
Yeah. But
if you're an EEN, and because in theory it's a new grad, it should be.
I'm also...
Based on our previous...
Yeah. I'm also curious about why she missed the medication, and that seems a symptom of anxiety. And if I was her team leader and it was a social work example, I would actually be giving her tools to manage her anxiety around the new role.
That's valid, but I don't believe that is even remotely considered in the medical profession. No, I would
agree. Exactly, I would agree with that.
Because of all the years that I had, because I get bored with nursing very quickly, so I was changing my areas of nursing every 2 to 3 years. I would just routinely change because I'd want to be stimulated again. Anyway, I always like to learn. I really like to learn. Or I got sick and tired of the politics and the bullshit. And that statement would also resonate with our audience. I, regardless, think that in the whole time, no one's ever asked that. No one's ever offered that. Even when I did all my advanced counselling and life coaching and trauma management for external, that was held by Queensland Health as external support, even for disaster management, none of that was ever offered, seen, discussed from peers or otherwise.
See, I quite regularly do that. I will critically look at with them in the supervision, go, oh hey, so you missed that, what was going on? Did something distract you? Did you get called away? Or did you feel like your anxiety was increased, so you missed, it was harder for you to go through the workflow sheet of what you were supposed to do? That's
something that is observed by a teacher to a student when they're on clinical placement, but not once you've got that bloody
See, I'd still be doing that for someone 6 months in. And I'd probably, even if someone came into a new role, regardless of their experience, I'd still be looking for anxiety around a new role, because doing a new job is anxiety provoking regardless.
But I think that's because that's your specialty.
Yeah, I guess.
Right?
Yeah.
You can't tell me that the police officers or the AMBOs would be doing that.
No, of course not. And I'm not
Because
saying
then, but it's because you work in mental health.
Yeah, that's what my focus is on.
Because that's your focus and that's your specialty. I can guarantee no, I can't guarantee, because you know what? Someone will prove me wrong.
Yeah, of course.
But
we would hope that people would be doing that. That's what we can say.
Best practice would be you'd want to consider that in the scheme of things to think about.
Also, with her talking about how she goes home and overthinks stuff, I would be talking about that in supervision. I know I've had a lot of students, like final placement students, and a lot of new grads who will do that. They will overthink stuff, and I'll have conversations with them around it. And I've also had a lot that will pre-plan a session. So for example, they'll be going in and they'll be expecting a client to be talking about XYZ. So they'll go away, let's say, and research anxiety and depression, because I think that's what the client's going to talk about. And then when they get there, the client, that's not their problem. And so they've spent all of this time creating a plan for their patient or their client or whatever, but it's not useful because it gets thrown out the window. And I imagine that could be the same, like what that responder said around, you know, the patient can have a different set of problems in 7 hours. So, you know, you might have been dealing with one set of problems when you were there on your shift. You go away, you go, okay, I'm going to look up whatever the problem is. And then you come back and that problem's passed and they've got another thing. So all of that time that you spent is wasted, and it just leads to burnout.
Well, that's a valid statement in honesty, because many things can happen, right? In theory, as I said from the beginning, I'm going to surmise or assume that because she's only 3 weeks into the role in that establishment, she would have been given one of the easier patients. Okay. But the other thing is, and let's be honest about this, is she an overthinker? Is she have anxiety that's more?
No, who knows?
Who knows? But that could also be impacting her.
I see from what I've read and my initial gut feeling, and because of what I do, right, is that she's so passionate about this work. She's been studying it for so long because she's had the 2 children and all of that sort of stuff, and now she's doing it. And it's almost like she's like, she's worked herself up into this state because she's been working towards it so long. So that's why, for me, it would be very much about anxiety management if I was her boss.
For me, I would see her trying to people please.
Yes, right? Exactly.
And I would say she's a people pleaser, personality. I believe she's a carer, and she's so used to sacrificing absolutely everything for everyone else, including her 2 children, that she herself may or may not have had a lot of support.
I think as well, she'd be so desperate to be better than good at the job because of all of the stuff that
I would say
done.
She also has issues around thinking perfectionism.
Yes, exactly. Yeah.
Very early in the piece.
Yeah.
And therefore then her putting more pressure on herself, besides people pleasing, they have great empathy, great carers, compassionate souls. But I sometimes, if that's where some of their overthinking comes from.
And it says she's been wanting to do this for 10 years. That's long time to be wanting to do something, and you're 3 weeks in. It's like, baby girl, take a breath.
But I wonder if that's because she's put too much expectations on herself, because she's a perfectionist.
Yeah, exactly. Because she's got skin in the game, because she's been wanting to do it for so long.
Yeah. And life has just created curveballs that have created different pathways and opportunities until now.
I think terrified of failure as well.
Oh, absolutely. But if you think about it, aren't we all?
Yeah.
In today's economy, in today's society, we're all scared of failure, because it could be the difference between a roof over your head or not.
Yes, this is true.
No, I mean that. Like, if you think about it, because remember, this is right now in today's economy. It's 1 day old.
Yeah.
So she potentially could be wondering what she's doing, because depending on where it is and what hours of work, it could be at the cost of her not being at home for her children.
Exactly, that's what I was thinking.
And is that in the background, ticking in the background? I wonder if this is going on, if that's going on. Are they okay? Depending on age, support, what's going on, you know, like, and then second guessing and then guilt associated to it all. Like, there's a lot of factors that could be in play.
I've got a mature age new grad student. Well, not student anymore. They were one of my students, and we've offered them a job. And in supervision, she has children, and a husband and all of those things. And she's regularly saying, I really hope that I've done the right thing because I've spent all of this time to do this thing that I'm really passionate about, but I could have been doing what I was doing before, which was bringing in enough money and, you know, and I had enough bandwidth then to be there for my family. Whereas, you know, this new role, it's taken a lot more bandwidth because of learning. Do you know what I mean? Like studying, especially the burnout of all of that. And I'm so passionate about it. I just want to do it right and make sure that I've actually done the right thing for me and for my family. And so there's that added layer of pressure there.
But people don't see that. Look, again, I suspect, and I'll wear my hat on my sleeve because I can't diagnose shit. Remember, as nurses, we can't diagnose jack shit.
Mm-hmm.
But I'll wear my hat on my sleeve. I wonder if there is a kiss of seeing things and feeling things far deeper than some people. And women are notorious, absolutely notorious to overthink. And the reason they overthink is because they are societally, as well as historically, as well as currently, expected to do such mental load,
so much more
in a household that they've got nothing but to overthink.
Yeah.
So, and this is why, and I know this is a really deviation for the topic, that's why women love cruising, providing they don't get seasick. Women love cruising because it's a done for you model. They don't have to worry about food. They don't have to worry about entertainment. All they have to worry about is what clothes to put on their body when they get up, based on the weather when they look outside, and, oh, there's a choice of food, what do I feel like eating? The mental load's been removed. And as soon as that mental load has been removed, even for 7 days, the reset is amazing.
You can relax.
You're not worrying about washing. You're not worrying about making the bed. You're not worrying about what food you have to buy, what shopping you have to do. You're not worrying about what entertainment you have to provide or deal with. It's all done. You just have to turn up. And I know, being the fact that I'm a people pleaser, overthinker, personality profile with, well, I have actually got a bit more than just anxiety, but regardless of that, I found that was the best mental break for me because I didn't have to think about it, and it was wonderful. All I had to worry about was, oh, there's the buffet food, what do I need to choose? And that was really
making me want to go on a cruise. Maybe we need to
need to do a cruise.
That's funny.
But no, seriously, and I don't think you realise, only because I've talked about it to you, if you ever get a chance to go on a cruise.
Oh, I've been on a cruise.
Do you agree or disagree with the mental load being reduced?
It was greatly reduced because, you know, I had young children at the time, and there was
obviously issues with young children.
Well, yeah, but there was, you know, like provider for them to look after them, so I did get breaks from them, and so that was really good.
If you think about it, your mental load was reduced as a woman.
Yeah,
right?
Yeah, significantly.
So can you then imagine you've put your life on hold for 10 years, you're now in your early 30s, you've got essentially, you will assume young children, unless you had them at 16, you're going to assume that they're young children, okay? You've finally got a gig that's taken you 10 years to get, and you're so hard on yourself because you want to make it work, because you want to know if the sacrifice is worth it.
No, look, I can totally put myself in those shoes because I was a mature age student when I got my social work accreditation or degree, and I was also a recent widow, so I had to make it work. I didn't have an option. So I can really understand that I put in 200% into the work that I was doing because I had to succeed. I didn't have a choice.
Well, see, I was similar. I
think so many of us are.
I was a single mum working in neonatal ICU, had to drop the kids off to their family daycare mother so I could turn up to work, could only work morning shift, could only work 4 shifts a week because otherwise it was just too much because I needed a day for me to be able to do food shopping and running around because it was too hard as a single parent. And my ex-husband ran away and relocated back down down south, down near the border of Victoria and Melbourne, Victoria, New South Wales border, down in that area, and never provided a single thing for the children. I was doing it solo.
Yeah, I remember when I was in child safety, which was my first role while I was still studying, and I had to put the children in after school care, and it was a 45-minute drive from work. After school care finished at 6. So I finished work technically at 5 o'clock. I could get there at 5:45 if everything went smoothly.
But if
there was an accident or if there was an issue in child safety and I had to stay back, which is quite regular, it was $1 every minute I was late.
I know.
Every minute I was late. And I really didn't have anyone. Occasionally I had, like in an emergency, but I really didn't have anyone to support me. And almost at the end of every day, I was holding my breath, feeling sick for that, to make sure that I got back in time to pick up my kids.
Yeah.
But then I was worried also to tell my boss, because I didn't want to be seen as a problem and not someone that wanted to put in overtime and all of those things. I was just like, I felt like I was just constantly at 10 to 5 going, please don't let a crisis happen. Please don't let a crisis happen. Please don't let a crisis happen.
But that's the story. And a lot of us have gone through this hard journey of trying to work out and prioritize everything. And then when do we take care of ourselves?
No, we don't.
No, exactly.
We don't.
No.
And that's often we come out of burnout from just finishing the degree, finishing the study.
But it's not just the degree, it's just everything all at once.
Yeah, exactly.
So
I'd be interested to hear other people's experiences as new grads and the anxiety that they felt and how long it took them to feel like they were good at the roles that they were doing and not to have so much anxiety and stress around making mistakes.
And to know that they're not alone, because as you're hearing from us and the emotion in our voices, regardless, it's been time since we were in that scenario as young, with the young ones, we do relate, and we can and 100% do feel through lived experience and knowledge of what it's like to be in this scenario and the stress and the anxiety and the overthinking. Is this a 13 11 14 number if you've got a drama?
Yeah, lifeline. If you need to reach out and talk to someone, call 13 11 14.
Otherwise, everyone out there, this is Between Peers, and we'll see you in the next one.